Hi, welcome back to Antai Hospital's YouTube channel, and in today's video we'd like to talk about uterine fibroids, how they seem to arise, and what is the new novel technique that we are doing here at Antai Hospital to help you remove them and importantly retain fertility. So uterine fibroids are simply benign growths that are non-cancerous, seem to appear in the parts of the uterus, cervix. They can even grow on the fallopian tube, ovaries as well. Now we cannot say for sure what seems to be causing them, but what we know for sure is that they are benign. They are not malignant. They do not lead to any cancerous development as well, and they seem to appear during your fertile years, which is 20s, 30s. Now this can be associated with your very well produced hormonal levels to assist fertility. This is your peak fertility window, and they seem to appear at that stage as well. We can associate this with the high levels of estrogen, progesterone. That seems to be the case here. However, it also can be caused by chronic hormonal imbalances as well, but we cannot say for sure what seems to be triggering them. But in many cases, they are very small and they seem to be very harmless. Sometimes they go away on their own as well. However, many patients suffer from fibroids that do not go away, and they seem to be growing larger and larger, exerting pressure, making the pelvic region, your belly area, to be somewhat painful. If you exert a little bit pressure, there could be some bulging, swelling, and most importantly, they affect your ability to get pregnant. That's very important. So many women, when they go for treatment, sometimes parts of the cervix, parts of the uterus has been removed, and not only is the uterus damaged, it can no longer carry a pregnancy. Now many women unwillingly go for this, sometimes willingly, just to remove the fibroids because it seems to be affecting their quality of life. And we do know that if you carry a fibroid while during a pregnancy, it can lead to miscarriage as well. So it's definitely something that you need to put an emphasis in. Try to get it checked early on, receive treatment before pregnancy, because there is effective treatment. So our novel technique is simply by injecting an apoptotic agent. Apoptotic agent is a harmless medication that is only designed to attack these fibroids. It differentiates other tissues. It's only specific to the fibroids. And what's special about this technique is that it does not involve any surgical incision of the uterus. We simply need to identify the position, and we can do that with using laparoscopy, and we can inject this medication into the fibroid, allowing it to be removed from the reproductive system, and then you can retain your organ entirely. There will be no surgery conducted on the uterus. That means there's no cuts, there will be no parts removed, and this, most importantly, there will be no any secondary damage or primary damage. Then this can almost guarantee you retaining this ability to get pregnant. Your fertility can be guaranteed. And that's why we call this ultra minimally invasive. It's one level above minimally invasive. Previously, we used to remove it using 3D laparoscopy, and we need to incise on the uterus. Now, with our development here at Antai Hospital, where our techniques progress, where there's more research being done, we found out that this is a better technique, and it almost has no downside. We can effectively remove these uterine fibroids, and we can ensure that the uterus is unharmed, and you can have normal menses again, you can have the pressure relieved, and you can have healthy pregnancies. That's the most important goal. Now with this uterine fibroid removed, and after a recovery, you can begin conceiving. You will no longer be infertile. You will no longer experience miscarriages, because these are usually the case with patients who have fibroids. Now, very importantly, you should not delay the removal of this uterine fibroids, because the longer you delay, the more difficulty you're going to cause yourself, because it gets bigger and bigger, and it affects your fertility much more, causing it to be much more complex. So get it done early. Now, if you go for conventional treatment, they will do surgery on the uterus. They may conduct hysterectomy. They will remove parts of the uterus, affecting your ability to get pregnant. They cannot guarantee that. However, here at Antai Hospital. We avoid that route completely with our new novel technique using that apoptotic agent injection. This way, the surgery is done very quickly, you can recover very quickly, and there's no recurrence, and quality of life is restored. Now, if this seems to interest you, if you want to find out more information, or if you want to seek this treatment right away, please make yourself down to Antai Hospital. You can talk to our consultants via email, via the comments down below, and we can have this fibroid removed ASAP and allow you to get on your journey towards healthy pregnancy. Now, I hope you enjoyed this video. Please leave a like and comment, and stay tuned to the next one.